I think an MOT is a good way of describing, that's how I describe it to my patients, because it gives you a bit of a heads up of what's coming. And we do like to think of these health checks as an opportunity to just lift the lid on health and understand what the main issues are factually with that person's health, but also what their concerns may be because they have a family history or something's happened to a best friend of theirs, and that's just playing on their mind. And it gives a good opportunity to be really open about all the areas and go through parts of their health that they may have not considered in the past, because we do try to do kind of a top to toe survey and touch on each element. And it gives you a bit of an understanding. Sometimes someone comes in with a concern about their skin, but actually when you break it down, you find out it's a gut issue they've been worried about. They don't sleep well, they don't eat well, and that's what's causing an impact on their health. So I think it's really a great opportunity to just have a very open dialogue, but that's very based on a lot of fact, because that we do observations, we do blood tests, and we do a full review. It means that this information we give is actually super useful for right now to do an immediate change in health, but also to plan for the next 2, 3, 5 years.
So how do employees benefit in terms of receiving health assessments, particularly with regard to prevention or early intervention of medical issues?
So I think there's a couple of aspects when it comes to how an employee benefits. First of all, I get lots of employees that come to do their health checks with me, and they really enjoy the opportunity to talk about themselves rather than it being about their work. It's now about them. And that focus does help them to feel very empowered about the fact that their health is of a priority to not only themselves and their family, but also to their employer. So that's one lovely way to just have a great dialogue. It also means that we can start planning ahead things that we know are going to start to become problematic. So obviously prevention is much, much easier than the cure. So we start planning things over the next kind of what's going to potentially be an issue over the next 3 to 6 months, and what's potentially going to be an issue over the next year to 5 years. And we can start talking about that with regards to family history, lifestyle, and the parameters that we pick up in our investigations. We can have a rough sketch of where we think things are going to go if we don't make changes, and where things will be if we do make sensible changes. And when we talk about these sensible changes, obviously it has to be very bespoke to the person we're speaking to. It's very easy to do a generic, don't smoke, do a bit of walking, drink enough water. But when it's specific to the patient, you can tell them the areas that they're going to pick up immediately and what's going to change over the next 3 weeks, 6 weeks, and then beyond. And so it makes them, again, much more empowered to take on those health benefits, especially if you talk about it as a family as well, the social aspects, because they all do play a part, and identifying what may be obstacles that will cause them problems to achieve their health goals, but also how you can sidestep that by working within a team, working with a best friend, or working with a partner to achieve those goals, because it helps everybody to have that health initiative in your mindset.
Yeah, and I guess that everybody is different with their own pre-existing conditions and their own predisposition for certain illnesses.
Exactly. And usually those predispositions actually do obviously work within the family. And then if you can be empowered to look after your own health, it will just follow on that your family also benefit from your changes.
So Verve is a suite of health assessments offering a range of tests. Can you just share with us some of the tests and the value that they bring?
Yeah, so obviously we have 3 areas: an essential, an extended, and a comprehensive. With the essential, as it suggests, we're just doing the basic stuff that everyone needs for the next 3 to 6 months to give us a quick idea of what's the chance of us having a serious illness that might impact our well-being and our ability to work in a happy way over the next few months. Stuff such as your weight, how it impacts your risk of cardiovascular disease, of stroke, and of bony injuries and musculoskeletal issues. In the extended, we again looking at a little bit of a longer time frame, maybe what may cause problems over the next year. So then we look at kidney function, we look at some cancer markers, we look at thyroid function, because these are things that may have an impact over the next year. And the sooner we get that into check, the less likely we're going to have problems in the future. And then the last one, obviously, is the most comprehensive. This one is done by a doctor. So the doctor goes through a full questionnaire, top to toe survey of everything, including social issues and family history. The blood tests are a lot more extensive. So now we look at cancer screening, we look at cardiac enzymes, which are an indicator of potential underlying problems with the heart that can cause serious impacts over the next 3 to 5 years, and trying to be proactive to change those. We look at inflammatory markers, because obviously they can have an impact on lots and lots of diseases, from inflammatory bowel disease to rheumatoid arthritis to lots of aches and pains, headaches, all these things that just slowly start going unnoticed until they become a real big issue. It's easy to pick up a test kit online that just does your blood tests and that's it. And you're still in the dark, because that test on its own doesn't mean anything without all the expertise that comes with seeing the doctor that understands health, and not only just immediate health, but long-term health management. So that's the key part, is you want time with someone that understands long-term healthcare management and how to make sensible steps to make those changes, and how to understand your blood test, be empowered with those results, and then know how to monitor them. So obviously part of our explanation is not just what we're doing for today, but also for your future. Which blood tests need to be monitored? Which tests do you need to have repeated? Which ones do you need to keep an eye on? Which ones are not worrisome right now, but may become a worry in the future? So again, it's the key is to be empowered to understand the reason why we're looking at these things in your health, and how to be part of that conversation and not just be at the end receiving the treatment. There's an extensive amount done with the doctor, including looking at an ECG. So that's looking for subtle changes within the heart and the way that it beats electrically, to see if there is, again, something we can do to prevent any potential harm in the future. We do an extensive breast examination and a testicular examination. And although these in themselves are just a one-off check for cancer, it's a great opportunity to teach people to try to look for these things early. The sooner you can pick up a small lump that could be cancer or precancerous, means the treatment is now much shorter. The chance of needing chemotherapy and radiotherapy is much more reduced. And even if you do need it, it's a much shorter course. And therefore, your ability to bounce back to good health is much more likely. So we're trying to think of it in a management of how to protect from diseases in the future by empowering, learning, and also being very engaged in each specific area of the body.
Yeah, and I guess some of that can have a knock-on effect if people spend a lot of time off work when they've got those medical conditions that have been diagnosed later on rather than early intervention. And I've seen situations where that's affected people's mental health as well.
Yeah, it takes its toll. Being unwell for a long time takes its toll, and it makes you more unwell in yourself. So the sooner we can pick up an issue and start treatment, it means your body hasn't had to go through the ordeal for a whole year. Much less damage to the body, much less damage to your well-being, and also being out of your normal sync is really harmful to your physical and mental well-being.
How important is it that assessments are carried out in a clinical environment?
These things are they are very important, because I think in a clinical setting, when it's a professional, it gives you the opportunity to be very honest. It's very well known within the general practice that patients will come in with one issue, and just as they're about to walk out the door, they have a completely different issue, which is usually the most important issue of that year for them. But it takes a while to build up that rapport and that trust to tell someone something that's quite worrisome deep down inside. And so the time that we allow for our GPs to have that consultation, to build that rapport, to go through things step by step, to encourage and tease out all those bits that are worrisome, is really important. And the clinical professional setting that we put it in encourages that. I don't think it would be the same as if we were doing it in a room in the back office of where you work. I don't think it has the same structure of trust and professionalism that we can provide in a clinical setting.
And I wonder whether or not some employees might just find that they're not as comfortable in that scenario.
Yeah, I can understand that that can be the case for lots of people, especially when it's something very deep down that's worrying them, or they really think they do have a particular problem. Some people think they have cancer that they've been living with for years that they don't have, and they just need a bit of support, or actually they do have the signs of it. They've just been too scared to go and get help because they don't know what's going to happen next. So it is important to provide that opportunity for genuine trust, genuine confidentiality, that we can support them through that journey.
Yeah, perfect. Thank you for that. And can you explain our minimum requirements in terms of the type of clinicians who carry out the health assessments?
So with our GP settings, obviously they have to be very qualified, very experienced GPs. So they're not newly qualified general practitioners. They've been doing this for a long time, and they obviously get a lot more training from us to make sure they understand what we're trying to achieve in these health assessments. Every company does things slightly differently, but we have a very clear goal of what we're trying to achieve for our patients. For the healthcare professionals that do the observations, do the ECG, do the bloods, again, these are clinicians that have had a lot of experience to deal with patients, to support patients through the journey when they're feeling anxious, to know how to escalate up when things don't feel quite right. So we have very clear guidelines of when, if things don't look right, don't feel right, how to escalate up and get help, either from the doctor that's in the clinic with you or the medical director that's on call, that's going to support you 24/7 to ensure the patient gets the safest treatment they need in that time.
Yeah, absolutely. Thank you. And I think one thing I should probably add is that Verve Healthcare is a subsidiary of CellDoc, and CellDoc have been providing nearly 30 years of assistance to the NHS through a number of different ways: 111 services, urgent treatment care, and out of hours GP services. So the credentials are there to be able to support the health assessments that we provide. Okay, so the overall costs of having a health assessment far outweigh the potential cost of absenteeism. But what is your sense towards a movement of prevention versus cure, particularly when the costs of private medical insurance are rising at record levels?
I think there is a big move now within healthcare, definitely, that prevention is better than the cure. We know that it costs less financially, it costs much less time. Time is a massive problem that we have for people to get access to healthcare in a time frame that works for them around work and their other commitments. And in that time, not only is your anxiety playing tricks on your mind of what could be going on, but actually if there is something underlying, all that time there is damage happening to your body that you cannot fix. So now the problem that you had on day one is a bigger problem 6 months later when you're trying to fix it, and it becomes much harder for everyone involved to then kind of take that by the horns and fix it. And obviously there's a big move over the last kind of 5 or 6 years for regenerative medicine, rejuvenation medicine, looking at living longer and living healthier, being able to push ourselves a little bit further than we've ever done. So a lot more people in their 40s are now looking to do marathons than they've ever done before. So all these things are pushing us that we want to be more active, we want to be more healthy, we want to take hold of our health, and I think we should be part of that process.
Yeah, absolutely. When I've been speaking to prospective clients, there's certainly an increase in demand for health assessments, which has potentially led to capacity issues within the industry. How does Verve ensure we don't have those capacity issues?
I think what we're doing quite well at the moment, because as you said, we are part of CellDoc, and CellDoc has quite a large number of doctors that work with us, that have been working with us for the last 20 years. And so it means that we have access to brilliant doctors all the time throughout the year. And we always actually have people waiting to have more shifts with us. So I think we're just a little bit ahead of the game because we're not new. People know us, they trust us, they like working with us. We have a lot of clinical governance support, a lot of operational support, because we've been doing this for a long time. We know what we're doing. We have quite a large growing network of clinics that we can utilize around the country. Lots of satellite clinics, so they're pop-up clinics. So depending on when or how many patients an employer has that needs, excuse me, that needs an assessment, we'll set up a clinic.
Yeah, and I think it helps that we've got a really good network of GPs and clinical professionals that we can call upon when we need to. Once again, thank you, Amina, for joining and giving your insights.